Professor Georgina Long grew up believing all of us can have an impact.
In my family, it was what you were passionate about, what you were good at, and how you could make a difference. How are you? Come on in.
That mission to make a difference has seen her become a medical oncologist.
So all of that's normal.
And one of the world's leading researchers of melanoma.
Melanoma is Australia's cancer. We have the highest incidence of melanoma in the world. When I went into it, there were no effective drug therapies. It was pretty depressing.
Professor Long would go on to lead an extensive program of clinical trials.
I'm just selecting my antibody.
Resulting in 10 new melanoma drugs, including immune checkpoint inhibitors that help T cells recognize cancer cells as an enemy.
So I lived through this incredible journey of all of a sudden, patients were doing a Lazarus. They were dying and then they were living. High-dose ipilimumab.
Her latest trials have centered on combination immunotherapy targeting multiple checkpoints. The results show the approach categorically improves survival rates.
And as time goes by, we now know that about 50% of people with melanoma that's spread, so advanced melanoma, are having long-term durable control of their cancer. Just short of a cure. We're not brave enough yet to say cure, but I'll say it, it's a cure.
Her research saw her become Joint Australian of the Year with pathologist and fellow melanoma researcher Professor Richard Scolyer in 2024. When Professor Scolyer was diagnosed with an aggressive form of brain cancer known as glioblastoma in May 2023, Professor Long was determined to intervene.
This problem was too big, and the grief was so great, and I wanted hope for Richard.
That hope would be found in Professor Long's game-changing research into treating secondary melanoma tumours in the brain. Specifically, the work that she led with her colleague in the Netherlands showed that immunotherapy could be used to shrink a tumour before surgery and improve outcomes. So could the same also be true for glioblastoma? Professor Scolyer consented to the treatment, which involved a pre-surgery immunotherapy regimen devised by Professor Long and supported by experts worldwide.
The ideas made sense. They were grounded in experience. Of course, there were many unknowns, and they were grounded in science, and that gave hope.
A year on from his diagnosis, Professor Scolyer is cancer-free, and Professor Long is working to publish their results and establish clinical trials based on the treatment. Professor Long says that's the beauty of science.
Whatever problem we're faced with that really, really matters to humanity and to our planet and to the universe, it's going to be in science, the answer.
A message she can now share as a fellow of the Australian Academy of Science.